For over 15 years, Have Oyoko Africa has been running marketable vocational training to reintegrate vulnerable youth into societies through the provision of vocational skills. Since 1998, over 8,000 youths, 40% females and 60% males, have successfully graduated from the Havoyoko skills courses, mainly in livelihood and employment creation for youth. Most of the beneficiaries are the poorest of poor among refugee returnees and IDPs, internally displaced people, while others are destitute orphans and other victims who depend on their relatives. The Vocational Center has rapidly grown and gained a reputation of providing quality education with high chances of employment upon immediate completion of the courses. The center initially started with 50 students who were applying for the courses and now receives applications from around 2,200 applicants every year. This high demand has encouraged Havoyoko to plan for the opening of more centers throughout Somalia. Bu Hod Le. We distributed a one-month food supply of dates, flour, rice, tea, water, and milk for 80 families. In Daryeel General Hospital, Gumes Sul, we distributed food for 84 families. Balad How Ghetto, we distributed food for 94 families. Tugdare, we distributed food for 84 families. Gabile, we distributed food for 162 families. Ergavo, we distributed food for 120 families. Ethiopia, we distributed cash of $50 per person for 60 families. The total number of families helped, 604. Health profile, Somalia. The health workforce is small, underskilled, and aging, often engaged in dual public and private practice, forced to work in an insecure and demotivating environment. In the absence of a functioning health surveillance system, accurate data on mortality and morbidity is difficult to obtain in Somalia. Somalia has some of the worst health indicators in the world, with life expectancy of 47 years, infant mortality of 132 per 1,000 live births, under 5 mortality of 224 per 1,000 live births, and maternal mortality of 1,600 per 100,000 live births. Infant, child, and maternal mortality rates in Somalia are among the highest in the world. Cholera is endemic in Somalia, with outbreaks occurring annually from December to June. Brief summary report of Havoyoko Observation Cholera Outbreak Team in 2017. We, the Havoyoko Cholera Outbreak Observation Team, visited a number of locations in Sul and Bihudle regions, Yeile, Arowain, Dilalo, Buhudle, and Gorelugud. It was so sad and unfortunate to see the impact of the hard-hit cholera outbreak in these communities. In Buhudle, at the beginning, the number of admitted inpatients was 1,750, and within a few days the total inpatients was decreased to 190, and again in the next day the number slightly increased to 202 patients. The patients who were in critical conditions were 81, and 3 deaths were reported. The number of healthcare staff who currently operate in the hospital are 82 nurses and 8 doctors. As for Yaile, another small town in the area, the number of admitted inpatients were 22 inpatients, and 10 out of those 22 were older patients, while 13 were under 10 years of age, and also 3 were under 3 years old. On the other hand, Gorelugud, another small town in the same area, was one of the hardest-hit cholera outbreak areas in the Togdir region, and 50 inpatients were admitted and 22 deaths were reported. The situation in all these 3 locations is deteriorating, and there's an urgent need for medical supplies, a public health prevention campaign, and food and water supply. We, Havoyoko, distributed 1 month of food and water supply. Thank you. We need your help. Here in Columbus, we're coming together to raise life-saving humanitarian assistance to the disadvantaged people in Somalia. Havoyoko, a registered 501c3 who's been working on the ground in Somalia for years, is taking on the role. Help us to equip and train community health workers in Somalia. Havoyoko is on the ground to train community health workers throughout far-reaching areas in Somalia to educate people on good nutrition, prenatal care, and early childhood health. And we're requesting you to donate generously to have the tools they need to keep families thriving. We've developed a donation system that will allow individuals to donate in one of several ways. 1. Go directly to our donate link above or at www.usahavoyoko.org and click on the donate button. Donate using your Visa or MasterCard. The site's confidential and secure. Or 2. You can write your check to Havoyoko, Havoyoko, and mail to the following address: 1925 East Dublin-Granville Road, Suite 228, Columbus, Ohio 43229, or P.O. Box 29400, Columbus, Ohio 43229. Thank you in advance.